In this video, I'm going to be focused on the area in the middle of the matrix, which is the present moment and the observing self. In other words, taking a non-judgmental and acceptance-based stance. It's so important for clinicians to start in the middle of the matrix, explaining these several principles, for example, the present moment, helping clients understand what it means to be in the present moment and to increase their awareness of the here and now. The second component is the observing self, helping clients to understand what it means to observe their thoughts, emotions, and behaviors, and finally to do so from a non-judgmental stance, merely as an observer. It's so critical for our clients to understand what is occurring within themselves, primarily because what has kept them stuck in many cases for years is the fact that their mind is constantly pulling them towards the future or dragging them into the past. Taking time to explain this concept to the client is going to be critical, helping them to know that staying in the present moment, staying in what we will explain to them as the observing self, and taking a very non-judgmental and acceptance-based stance is ultimately what is going to be healthy for them to make wise choices, to move toward their goals, and to move toward those things that will bring them to a more fulfilling and meaningful life. These three concepts in the middle correspond to three of the concepts in the hexaflex. The present moment, which is to be mindful of what is going on currently around the individual. The second is self as context, which here I've labeled it as the observing self. And finally, non-judgmental stance corresponds to the hexaflex term of experiential acceptance. The present moment should be explained as what is occurring in the here and now, things that we can sense with each of our five senses, what we can see, hear, touch, smell, and taste. This is a great time to talk to clients about mindfulness and about being grounded in the present moment, in the here and now. We can also explain that awareness occurs in the present moment. When we're not grounded in the present moment, what the client finds and what the clinician will observe is the client will immediately be drawn back into the void of worrying about the future or being dragged back into the past of ruminating about what has already occurred. The next concept in the middle is the observing self. In the hexaflex, this is defined as self as context. This is the ability that humans have to be a witness to our thoughts, feelings, and behaviors. I like to explain this concept to clients using several different metaphors. For example, you can explain that as we live life, we are sometimes like an actor on a stage in the middle of a play or in the middle of a movie. The observing self, on the other hand, is like the director who is sitting outside of the actors and watching their movements and what they're saying and what they're doing. As humans, we have the capacity to both be in the moment and living our life, but we can also pause and take an observing self stance and think about what we are doing, what we are thinking, and what we are feeling. Another fun analogy that I use both with teens and adults, speaking about the observing self or self as context, is thinking about a fish in a fishbowl. As humans, we can think about being the fish in the fishbowl. We are swimming around the little obstacles and things that have been placed in the fishbowl, and maybe we go up to the surface to grab some food pellets, and then we swim back in. That is us being the fish in the moment. Being the observing self is to actually then take a step back and imagine we are the owner of the fish and we are observing what the fish is doing. We can think about and watch the fish swimming around those same obstacles, swimming around the bowl, going up to take the food pellets and coming back down. This is the observing self. In clinical terms, it is helping the client to take the time to be aware of what they are doing, thinking, and feeling. This is one of the most powerful tools and concepts in ACT that unfortunately is overlooked or dismissed by both clients and clinicians because it's not quite as exciting or involved as some of the other ACT tools. The observing self, though, is very empowering because it is that skill that clients can begin to develop to take a step back and to begin to make decisions that are long-term based and that view the bigger picture. The observing self, once again, is as though it's a director watching the scene play out rather than being the actor caught up in the moment on the stage. The director has the ability to change course, just as the client can learn that they have the ability to slow themselves down and to make some wise decisions as to where they want to go. The last concept in the middle is a non-judgmental stance. The concept of being non-judgmental is critical in the ACT matrix and for clients to learn as they implement the ACT matrix in their life, so they can begin to look at their thoughts, emotions, and behaviors in terms of learning opportunities and making different choices, rather than what they have typically been caught up in, which is judgments towards themselves based on the thoughts they're having or the actions they are taking. Helping them to take a non-judgmental stance and to look at thoughts, emotions, and behaviors as things they can learn from and things that they can begin to improve on can be very empowering for clients. Now that we've discussed what is happening in the middle of the ACT matrix, from here on out, as you go through each of the quadrants with the client, it will be important to pull them back to the middle of the ACT matrix to reinforce the concepts of the client being in the present moment and observing each of these areas from the observing self and taking a very non-judgmental stance as they do so. This will be especially important as you move towards quadrants 2 and 3 and begin to discuss some of the powerful thoughts and emotions and some of the behaviors that clients have been stuck in for years and years and that have created a lot of the pain and suffering that they have experienced through much of their life. In the end, you're helping clients to understand that they can become the director of their lives, that they are not merely an actor on the stage that is hearing a director shout and criticize and scrutinize their actions, that they can both be the actor that makes up the play or the movie, as well as being the director who is learning to be more kind, compassionate, and encouraging about what is being done and how it's being done on the stage. That they themselves need to be one and the same, both the actor as well as the director of their lives. As they learn to do that, they find that they make wiser, more meaningful, and fulfilling choices to become the person that they ultimately want to become and achieve the goals that they want to achieve. In the next video, I'll be talking about quadrant number 1 and how we begin to discuss values with clients. Again, always bringing them back to the observing self as we begin to talk about values.